Okay, I think we'll give it a start and people can come and join us as they join in. Welcome everyone to this knowledge sharing event, which is all about how we can better support carers of those with neurological conditions. And thank you to everyone for giving up your time here today. I'm delighted to be joined by a wonderful panel of experts who each come on with a different and unique perspective. We're really pleased to see so many carer centre staff here today alongside our own members. When we decided to host this event, our aim was to build the network between the two sectors, and I'm optimistic seeing how many people in this room that new alliances and connections will be made. To those who don't know us, we're the Neurological Alliance of Scotland, and we're an umbrella group of over 50 neurological charities. There's an incredible wealth of expertise amongst our membership, and I am really happy that we're bringing everyone here today to discuss the important topic of how to better support carers of those with neurological conditions. So just to give a bit of background, a year ago, we published a report which looked at how carer centres support people who look after those with a neurological condition, and it uncovered a huge amount of work going on, including the provision of condition-specific information and signposting to neurological charities. We also surveyed our members, which showcased a big range of support that our members are giving to carers, including providing information, counselling, peer support groups, grants and things like that. And so whilst this report noted there is a reassuring synergy between the two, between carer centres and neurological charities, there is more that could be done. And that's where we wanted to come in today and bridge that gap. I mean, everyone here today will know the enormous economic value of unpaid care, and yet the systems set up to support unpaid carers are often quite complex. Our interest in supporting carers is underpinned by the complexity of neurological conditions. People are impacted in a myriad of ways, including balance, mental health and well-being, speech and swallow, memory and cognition, and no two people experience the same condition in the same way, which means no two carers will have the same challenges. And our aim is that all carers are given the right support at the right time. And to do this, we have to first tackle the stigma that comes from the label unpaid carer, which is a well-recognised barrier to many people. And you may have noticed, in fact, that our event title refers to care partners, not unpaid carers. And we think there's an opportunity to change things and perhaps change the narrative around this. Before I introduce you to our speakers, we're going to share a link to a quick poll that you can access through the QR code. If you've got a smartphone, all you have to do is hold it up and capture the QR code on the camera. If you don't have a smartphone, you can also just click the link that Hester's going to put into the chat box. If you could just take a minute or two to do this, this will allow us to see who you are, where you're from, and what you're hoping to get out of today's event. So we'll just spend 60 seconds or so just doing that today, right now. Thanks, Hester. Okay, I'm just going to move on. People can carry on with that if they're still in that part of it, but time is of the essence today. Before I move on to the introductions, in the first part of the event, I'll be asking panelists some preset questions. Each panelist has just 2 minutes to answer the question, and I will be ruthless with my alarm, and I'll be raising my hand 30 seconds before so the panelists know roughly when they have to wrap up. Please save your questions for the second half of the event when we open up to the floor. If you have a question, please use the app icon, the raise hand icon, to draw attention to yourselves. And Hester and I will both be keeping an eye on the chat box if you want to put your question there as well, and to see who's putting their hand up. For timekeeping reasons, again, please make sure the question you ask is short and succinct, and ideally directed towards a specific panelist or more than one panelist. But if you can direct it, that'd be good. Moving on to some introductions, I'm delighted to welcome here today in alphabetical order Becky Duff, who is the Scotland Director of the Carers Trust, Becky, can you give a wave just in case anyone who has you on their screen can see? Thank you very much. Caroline Christie from Carers Together. Caroline, can you wave? Thank you. Kathy Quinn, who's a volunteer with Parkinson's UK Scotland. And last but not least, Phelim O'Toole, who's the manager for Edinburgh Headway Group, which is a charity supporting adults with acquired brain injury. Right, each of the panelists now has a maximum of 5 minutes to introduce yourselves, and we'll start with Becky. Over to you, Becky.
Thanks, Alice. I feel like I'm on countdown. I think that's like pressure of the time all the time. So, as Alice said, I'm Becky Duff. I'm from the Carers Trust, and it is so lovely to be here today. I see lots of carer centres that we work very closely with, which is brilliant. And in a former role, I worked for the MS Society for a long time, and also chaired the Neurological Alliance in that role. So it's so nice to see familiar faces. And actually, since joining the Carers Trust, I've been talking to Alice about actually how can we bridge that gap between those kind of carer services and those supporting people's neurological conditions. So it's really exciting to be here today. The Carers Trust is a UK-wide charity, and our mission is to transform the lives of unpaid carers. So we do this in several ways. We are very active in the kind of influencing space. We do a lot of work with Scottish Government, local authority, health and social care. And that's really about trying to make legislation, policies, and practice that actually work for carers and make sense. So we also do a lot of kind of public awareness raising, and that's really to support people to identify as unpaid carers. I don't need to tell anybody in this room that actually that can be one of the biggest hurdles, actually attaching that label to yourself. And I'm going to talk a bit more about that in one of the questions. And finally, and I would say most importantly, we support a network of local care organisations, some of whom are on today, and they're all delivering frontline services for unpaid carers. And I just wondered about setting a little bit of a context. So there's an estimated 800,000 carers in Scotland. I think it's probably way more than that. Around 30,000 carers who are under the age of 18. So at Carers Trust, we've got a real specialist interest in young carers, although we do work with carers across all age groups. 1 in 10 of us is currently fulfilling some kind of caring role, and 3 in 5 of us will at some point in our lives. So this is all of us. This isn't the somebody else. This is, we are all likely at some point to be touched by kind of caring responsibilities. And I suppose that's why I'm here today and why I'm so excited to be here today, because for me, caring is everyone's business. I really want us to explore how we can work together to build those caring communities in Scotland. It's never been more important. Don't need to tell anyone again about how tight the fiscal environment is just now. Budgets getting cut left, right, and centre. Aging population with deteriorating health and a health and social care system already on its knees. We absolutely need to be supporting unpaid carers. It's all of our business. We're all in trouble if we don't. So it's really exciting to kind of be here. Always very nervous to be called an expert, because I'm certainly not. Particularly when I look at the panel that I'm sitting with. So I don't claim that. I have lived experience. I was a young carer and a young adult carer, and that brings a perspective for me. But I'm hoping what I can really bring today is that bridge, having experience of working with the kind of neurological community, and now that experience of working with carers. I'm hoping I can bring a perspective above that, and also that national perspective. So I think that's all I'm going to say just now, and get a gold star for being well within time. No pressure, guys.
Absolute gold star to you, Becky. Thank you very much. That was a great intro, and we'll move swiftly on. We'll take advantage of that saved time and move on to Caroline.
Good morning, everyone. My name is Caroline Christie. I am a carer information lead at North Lanarkshire Carers Together. I do love my job. I love helping unpaid carers every day to find supports and provide information that's going to help them with what is a very complex world. I am going to talk a wee bit more about my role just in a wee second or two, but I just also wanted to let you know that I also have a caring responsibility. So I'm here today with 2 hats on. I have 3 adult children. I have one grandson. I am a sister, I am an auntie, I am mum to two wee fur babies. I am also Peter's wife and I'm an unpaid carer. This is my hubby, Peter. So he's a wee bit older in one of the pictures, but apart from that, he just looks like the same person. Yeah, actually, no, he's not the same person. The first picture was taken 12 years ago when he was, as what's classed as neurotypical, didn't have any issues at all. And the picture on the right was taken just a year ago. He is neurodivergent with an acquired brain injury. It's difficult for my family and friends to understand that he has a brain injury because physically he just looks the same. After many years, he can now work again, he can now drive again, but he absolutely won't be the same person again. Peter has a brain injury as a result of an assault. So that was really difficult for me. I've had many caring responsibilities, natural caring responsibilities, looking after grandparents and things like that, just as they're getting older and more fragile. This caring role has been, it completely blindsided me because it was something that happened to him through no fault of his own. So that put me into an immediate caring role, if you like, and having to come to terms with the changes to Peter and that the fact that he was very different to the person that I'd married 20 years ago. So we have many challenges, even with the experience of me working within the third sector, but we do celebrate every day that obviously he's alive. We've got a different version of him, but he's alive, and we celebrate that. That does take a lot of planning, emotional support and peer support, but we are getting there, but life can be challenging. So as I said earlier, I'm here today in both a professional and a personal capacity, and I do use my experiences to offer support and help influence changes within the local organisation and also nationally. And I do believe that if we all work better together, we can influence change. So I've worked in the third sector for almost 20 years now, and worked within North Lanarkshire Carers Together, supporting unpaid carers for over 10 years. I do love my job. Every day is different. We are one of 3 commission services in North Lanarkshire, and we provide the campaigning, representation and information service. The organisation came about 21 years ago now through a small group of unpaid carers determined to make a difference. Some of these carers are still on our board of directors, and they continue to influence positive change both locally and nationally. One national example being the implementation of the Carer Scotland Act. We were instrumental in consulting with unpaid carers locally to feed information and views across. One local example is a local consultation to look at what short break means for people, because obviously that means something different for every individual, highlighting the fact that every carer's role is different. Every person with a long-term condition or an illness displays different symptoms as well. So we wanted to recognise that, and you know, what's a short break for one person might be different for somebody else. The campaign resulted in a funding of 11 carer breather services in 2022, offering support to carers in a variety of ways to ensure that they get a break from their caring role. So we have we're just a small service. We have a staff team of 12. We host an information service. We've got a carers forum. We have an independent advocacy service and a family support service. So we've got all different programmes of work going on, but we've all got the same goal, which is to better support unpaid carers and help influence those policies and ultimately improve the lives of unpaid carers. I believe the key is for partners to work together and alongside carers learning from their experiences, and I'm delighted to be here today to share some of the good practice and hear other good practice from local charities and from carer centres, and of course I also feel that my personal experience with caring roles helps. All of our staff at our organisation are either carers or have been at some point, and I do think that brings a wealth of knowledge to the organisation. It allows us to offer empathy when we're having those conversations and really connect. And I do tend to find as working for an organisation with charity status, we build up a quick trust and rapport with the people that we engage with. We do tend to find that sometimes they're a wee bit more reluctant to share their experiences or how they're feeling or the challenges and barriers that they have with some of our statutory services for fear that, you know, perhaps their loved one will get put in a care home, or they'll be, you know, judged as not being competent. So I've got the hand up, so I'll quickly draw it to a close, but thanks very much for having me today, and I'm really looking forward to the event. Thanks, everyone.
Brilliant. Thanks there, Caroline. I'm going to move quickly on to Kathy.
Hello, everyone. Beginning to feel like a fish out of water here. Yes, Kathy, I realised I've written out what I was going to say, which is so brief. It would take about a minute. But very roughly, way in the dim and distant past, before any of you were born, I trained as a nursery nurse, then a general nurse, then I trained as a midwife, but then went to Bible college and all that was left behind. I married a man I'm from Edinburgh. I married a man from County Fermanagh who was farming at the time, and then trained for the Anglican ministry. So we went to London for that, 2 years there, 3 years in Bedford, Accuracy, and then came back to Northern Ireland. We used to come back to Edinburgh for holidays sometimes, because my father was still alive. When my father died, he left the flat to us, and that's where we decided we would retire to. Just before we came back to Edinburgh, my husband was diagnosed with Parkinson's. So the move back to Edinburgh was actually very good because of the city and easy access to things, or reasonably easy access. I joined the Edinburgh branch of Parkinson's UK and was quickly voted on to the committee. And I served there for a lot of years, put it that way, and resigned from it in March 2020 at the AGM, and then went into lockdown. After my husband died, which is 16 years next month, I got more involved with the branch, and I helped start the Singing for Fun groups, which was for people with Parkinson's, carers and friends. And that way, with opening it up, we were raising awareness of Parkinson's. I also got involved in starting up the side-by-side course, which gives information to the carers of people with Parkinson's. It's roughly a 6-week course, and they get introduced to the Parkinson's advisor, who helps them fill in forms for attendance allowance, PIP, blue badge, general advice like that they really need, wills and powers of attorney. We get the speech therapist in, we get somebody from the Aslancy Hospital to explain the services that they offer. We get somebody from Vocal who speaks about coping with change and stress. But we get the Parkinson's nurse specialist to come as well. We also finish with what we call a pamper day. And that's when we offer a therapy, usually reflexology, head or hand massage, just something that doesn't involve undressing. Now, from the side-by-side course, we started up the support group. And quite a number in the support group now are widows, and we've got one widower, because they want to give back experience and help they've had and help those who are still going through the process of caring. It's a protected area because what's said within the four walls, it gives people an opportunity to offload if they need to. We sometimes have tears, but that's perfectly all right. We always have laughter. We always have tea and coffee and scones. And yes, it's a privilege to work with these people. And yes, I think that's about it. My monthly support group is open. If anybody would like to come, let me know. They'd be very welcome. Thank you.
Thank you, Kathy. That was wonderful. Last but not least, we'd like to introduce Phelan, who's on mute. You're going to have to unmute yourself.
Yeah. Morning, everybody. My name is Phelim O'Toole. I'm the manager of the Edinburgh Headway Group. So I've 3 very difficult acts to follow after them great introductions. So the Edinburgh Headway Group is a charity that's founded 42 years ago to support adults with an acquired brain injury in Edinburgh and the Lothians, but also to support their carers and loved ones. We provide in-house group-led activities for physical, cognitive and emotional rehabilitation. It's a great place to be. We've developed a very safe and warm community of people who help each other as much as we help them. Socialization and isolation are massive topics for people with an acquired brain injury. A brain injury can affect your life and the life of your loved ones in a matter of seconds. And we need to recognize that and be prepared for a knock coming to our door. I very accidentally ended up working in the third sector and within Edinburgh Headway Group. So I moved to Scotland about 4.5 years ago, and then went into COVID. So my plans more or less went out the window. So a very long story, but a very accidental fall into Edinburgh Headway Group. And I do say it's a bit like a prison. It was quite easy to get into, but it's very hard to get out of. But I do love it and I love my job. But it's only in my time in Edinburgh Headway Group that I realised how much lived experience I had of brain injury and of neurological conditions. So as a young child, I was exposed to an aunt with an acquired brain injury, which she had suffered through seizures at the age of 3. My family went on to found a charity called Ballyrain Services, and to support other families who had people with disability and who didn't have the provision to look after them as we did with Auntie Anne. The charity went from strength to strength, and there's now 42 residential services in the southeast of Ireland. Over time, I went on to care as a carer for a grandmother with an acquired brain injury through a stroke. I've also cared for family members with Fredrickson's ataxia and also with Huntington's. And in the recent months, I've lost a very dear and close family member through a hypoxic brain injury. So it's all quite raw for me. And I've realized in my time here how exposed I was to brain injury and neurological conditions without knowing I was for so many years. And when you look across the population of people and start talking about headway and brain injury, you realize that every one of us is exposed to brain injury, and we are very, very vulnerable. And it was only on reflection over time, something I knew all of my life, but only something I've come to realize now and I probably accept, is the fact that I acquired a brain injury at birth, a hypoxic brain injury due to lack of oxygen. Luckily, it didn't affect me, although there are some family jokes about that. But it's quite raw to believe that I too suffered a hypoxic brain injury, and I held the hand of a brother who died of one only months ago. So I have plunged myself into raising awareness about brain injury and the risks, and also trying to prevent brain injury through educating the wider community of Edinburgh, through social services, through partnership charities, and just the general public. Sometimes it's somebody I bump into in the park walking the dog, and they'll come along to some of our training sessions. So it's about building up the awareness. It's the biggest cause of adult disability in the UK. So we run a carer space and have a dedicated carers coordinator with a lot of lived experience as well, to support our unpaid carers of Edinburgh Headway Group. But we also support any other carer who has a family member with an acquired brain injury, even if that person is not a member of our community. So that's me. I'm really delighted to be on the panel, and I'm really delighted to have met the other panelists, and we've had really good fun preparing for this. So we're really excited. That's me.
Thank you, Phelim. That was a wonderful intro as well. So I hope everyone's now got a really good idea of who our panelists are and their background and their experience with neurological conditions and supporting carers, unpaid carers. The first question we're going to actually ask to all of them, and we'll go round again in order, alphabetical order, if that's okay. Starting with Becky, could you name 3 things that make a big difference to you, to your charity, or to the carers that you support, that you'd like to share with us?
Yeah, so I think I was thinking about this, and actually the 3 things that would make a difference to me, sort of personally, me professionally, and the charity and unpaid carers, are the same 3 things. So that's good from a time point of view. But I think for me, the kind of first things around that everyone knows what it means to provide unpaid care, and that sounds like a bit of an odd thing to say, but I was an unpaid carer probably for the best part of 20 years without ever knowing that I was an unpaid carer. And that meant that I didn't get the support that I would have actually made a really significant difference to my life then, but also so my life kind of ongoing. So actually knowing what it means, because I think sometimes, and a lot of the people we speak to, a lot of the carers we speak to, if they're not providing 50 plus hours of care with somebody with, a real acute physical disability, they don't identify themselves as, I'm not a carer, I just do this, I just do this. So actually that's one thing I would love to see change, that actually we as a society, we understand what it means, what unpaid care means, and that we've got that kind of shared language. The second thing I guess leads on from that, and that's about that Scotland's carers are identified, and not just identified, but done in a really easily compassionate and empowered way. So I would love it to not be a big deal that you're an unpaid carer. I would love it to be just a part of your identity, not even necessarily the defining part of your identity, but actually that it's something that you can express, that you can share, and it's not a big deal. And the third thing, I'm taking my time from earlier, I would like to see that gap between carers' rights and the implementation of that closed. So actually, if the Carers' Rights Act was met, carers would be able to live fulfilling lives alongside their caring roles. The problem is it doesn't happen at implementation.
Thank you, Becky, for keeping to time. Same question to Carol-Anne, the 3 things that make a big difference to you.
Thank you. So I would say early intervention with consistency. I would say secure funding, because I think, when you work in the third sector, that's a massive issue. Organisations lose good staff, they lose good services because we don't have that commitment to funding to allow us to develop. And I would also say the joint working for a service that provides information. It is all about the collaborative approach. We wouldn't be able to operate if we didn't have those links with local partners and national partners and have an understanding of the landscape and what's out there. So yeah, that's my 3 things.
Gosh, that was very quick. Thank you very much. Kathy, same question to you.
Same question. Yes, I would, 3 things that come to me. The government, and I know this varies from health boards and councils, but that the government and the councils and healthcare professionals would really listen to carers. We're the silent workers that they seem to ignore, but so important, save them money. That respite or befriending agencies would be available. That would be a huge help. I'm thinking particularly with Parkinson's people. And this applies to Edinburgh Council, that they would recognise how essential blue badges are for people with Parkinson's. And to the society and to Edinburgh in particular, that would make a huge difference. Thank you.
So yes, we're getting a big range of different ideas here. So these are all great. Phelim, over to you. Same question. What 3 things would make a big difference to you?
Okay, thanks, Alice. For me, number 1, to partner with other charities with similar goals for their carers. and to develop pathways, peer support, and share knowledge. And just to point out that that is actually much easier done than it sounds. Just from a quick wee chat with my fellow panelist, Kathy, we've already established a relationship where we can attend each other's support groups and share knowledge and things. So it's easy. All it does is just a bit of chat, you know, a bit of face to face. Number two, I think a better education of the community in general would help carers to be recognised for their roles and to have their needs recognised. This could be up to a national campaign level. And also for carers to be allowed to recognise themselves that they are a carer at the earliest possible time, and in this capacity that they have rights and entitlements. That's mine.
Fantastic, thank you very much. So we've had a big range of ideas there. I've jotted them all down, and I'm sure they'll be threaded back through the next set of questions. But Phelim, you've introduced my second question very nicely, which was how do we get people with caring responsibilities to see themselves as carers and therefore to be able to access support at an earlier stage? Phelim, would you like to start with that one?
Yeah, sure. So thinking about this question, a lot of things came to light. So a lot of the time a carer is told that they're a carer, okay? They will mostly perform their duties out of a sense of duty rather than just having to do it and don't see themselves in this role. So I think the earliest we can intervene, and like an early intervention is the best way. And how we do that is, it's important for us, from my point of view as a service provider to their loved one, is to engage the carer early and lead them gently into that community and what support is available to them. And also to not overwhelm them at the start, because as known with brain injury, their life can change in a matter of seconds. So it could be a case where they have to adjust their house, they might have to move house, they might have to leave their job, they might have to, there's a massive change to their life. So the worst thing it could do is to overwhelm them, but just know that we are here for them. And even if we're able to engage them even before their loved one comes to our service, so we link up with the likes of the Astley Ainsley Hospital, and we have a presence in the hospitals where we're meeting the families and carers of the individual. I think peer support, to lead them into peer support as early as possible so they can come to a place where they feel safe, where they can let their guard down, they can let their emotions out, and they can see that they're not alone. And I think to let them see themselves as a carer, this early intervention support and being part of a peer support group leaves them in no doubt that they're part of a carers community.
And just off the back of that, how do people get to you then from the get-go? What's the typical referral route to you, to Edinburgh?
So the referral. Sorry,
yeah. So yeah, as a person who has an acquired brain injury and therefore the carers as well. Okay,
so typically our presence in the hospitals and knowledge are advertising of our services to healthcare professionals. On discharge, they'll often be given our details and maybe given an introduction by their occupational therapist or an outreach nurse. We'll also get referrals via GP services, social care services, and a lot of partner charities such as Rowan Alba, Sight Scotland. So educating the wider community and partners has increased our presence, and giving them that acquired brain injury awareness training has spread the word, so that we're a lot more present. So then it's either the healthcare, the referral form should ideally be filled out by a healthcare professional or a social worker, or it can be by a loved one. And it's at that point where we will intervene with the carer and family. As next of kin, we'll reach out to them, we'll educate them about what we can provide for them, and try to engage them as much as possible. And one of the biggest barrier to them engaging is their lack of time. That's
fantastic. Okay, thank you for that. I wonder if, Kathy, you've got a different perspective on this. How do we get people with caring responsibilities to see themselves as a carer?
Yes, I mean, I can remember being in that place when Cecil was first diagnosed. I had promised to care for him in sickness and health. So I didn't see myself as a carer. A carer was somebody that was paid, and I was definitely not paid. And in the beginning with Parkinson's, it's a slow, progressive illness. And it's only when you start having to do more for them that they couldn't do for themselves, like tying their shoelaces, doing up buttons, that you realise you are caring, you come to that. And I know in the support group, this comes up again and again. Oh, I don't think myself as a carer. But the rest of the group say, well, actually you are, and we understand that you don't grasp it. But as the condition progresses, they become very aware that they are carers. So it's, yes, as I say, it's gradual, very gradual.
So is there a way, and this is open to all panelists, is there a way that we can capture people at an earlier stage, not necessarily when the route is via hospital referral that way, but for conditions like Parkinson's, is there any way we can actually capture people at an earlier stage and give them that support? Becky, you put your hand up.
Well, I think so I think one of the things, right, we see person with condition and carer as these kind of two separate things, but actually they're not. Well, they're two separate people, but so I would say that any conversation, at the point that you're having a conversation with someone about the condition that they, have been diagnosed with or experiencing symptoms with or whatever, that's actually the point that we ask. So who's in your network? Who have you got at home? Who have you got in that kind of broader sense? You don't have to like use the C word at that point if it's not the right time. But actually from the very beginning, if we just stop seeing these kind of because they're not separate entities, and those will on the panel be able to speak a lot better to that. What is happening for the person you care for is absolutely critical in how it influences how you're feeling and how you're doing and what you're able to to do. So I think just as soon as we start having those conversations, even pre-diagnosis, and who have you got around you, what's your network, and just bring them in at that point so that it's not this you're not kind of just a carer when it gets to crisis point.
Analyst nodding. Generally speaking, earlier and at an earlier stage. Our next question around carers and how the question is, how can carers and available to them?
Is it just me or is Alice?
I was about to say, Alice, I think your bandwidth just dropped.
Yeah.
Okay.
But you seem
I've turned off my camera. Can you hear me now? Can you hear me now?
Yes. I don't think we heard the last question. Thank you.
Thank you, Morna. Yeah, I've just turned my video off for that reason. Thank you. So the question was back to Becky then. How can charities, so neurological charities and others, help change the narrative around carers and increase their visibility?
I think this is a really tricky one, and I think Kathy really kind of touched on it so well. For some people don't want to have that label of carer. Actually, it's not a helpful label. It doesn't feel like an empowering label. We talk a lot about like it's time to say the C word, but actually the problem with the system at the moment is that identifying a carer as a carer, it's almost like the magic key that opens the door to the support that you're entitled to get. So I think as organizations, I think it's helpful to acknowledge that for everybody, it's not, they don't want to identify like that. but actually to get the support, and I don't say the support they need, I use the term entitled very intentionally. As a carer, you have rights, okay? So to get that support that you're entitled to, you need to go through that identification process. So I think making that as painless as possible, having really, it sounds so basic, but really easy, accessible materials that ask the right questions, because again, it's back to this, well, if I'm not caring for 50+ hours, I'm not a carer. Actually, are you picking up a prescription for somebody? Are you dropping off meals? Are you doing the shopping for your mum 3 times a week? Are you phoning the doctor about somebody's care? Having almost like a bit, it sounds really kind of basic, but actually a bit of a checklist that sort of says, actually, you might be an unpaid carer and you might be entitled to support, whether you want that label or not. You don't have to have it here. You don't have to have it out there, but it is the thing that kind of opens the door. So I think for us, changing the narrative, it's that normalizing, it's that acknowledgement that this is 3 in 5 of us. I will go back to that stat time and time again. This isn't somebody else. And actually, even if you don't immediately identifying as kind of having that caring responsibility, like meeting people with compassion, which you will all do, and not being afraid of that. And I think where Carer Centres do an amazing job is that they create a space where you can have a really open and honest conversation about being a carer. And sometimes being a carer is really hard and not fun, and you might feel angry, you might feel resentful, you might, there's all these things. That doesn't mean you don't love the person you're supporting. It doesn't mean that you're not still a brilliant mother or wife or sister or daughter or whatever it is, but actually it's really complicated. So I think creating those spaces where actually we can have a really open and honest narrative about the realities that we're facing and know that we're going to be met with compassion and without judgment is really key. I always like to talk about it from that rights-based approach, like actually this is how you get what you're entitled to. And yeah, so that would be kind of one thought, but I think Caroline will probably have an interesting perspective on this as well.
Thanks so much, Becky. Yeah, Caroline, are you able to speak, or is your internet still up and
Yes,
down?
I'm here. I'm just getting that kind of what do you call that word? Dialect. Becky was sounding like a Dalek there, so I've turned my video off and hopefully you'll be able to hear me. But I absolutely echo everything that Becky has says, and going back to what you says in your intro about carers are everyone's business. And certainly working from a carers organisation perspective, it's about getting information out there. It very much is about information campaigns, sharing information on carers' rights and things, so that if you've got people in GP practices, have it on the loop within the GP practice when you're sitting there, killing time waiting for your appointment. More often than not, people with conditions will have a carer with them when they're going to these appointments. We have a presence similar to what Phelan was talking about. We have a presence within the local hospitals every month, and again, just to pique curiosity, because for many carers, as we've already alluded to, they don't think that they're carers. They're doing what they want. They want to do their best for the person that they care for. So we see a responsibility to get ourselves out in the community and to have those really meaningful conversations, because that is what it's about. It's about listening and giving the carer the opportunity to, I keep talking about the big painted smile, we've got to feel we've got to be everything to everyone, and actually it can be a really powerful thing to be able to share and talk about your experiences and actually admit where you're struggling or that you need a wee bit of help. And it isn't, and it's spot on, Becky, about the bit that it isn't about giving everybody a label, but the reality is that until you understand you've got those caring responsibilities, you won't access the support, you won't know about the support and the fantastic resources that are available. But yes, so for me, it is really just understanding that everybody has a part to play. It's not about charities just focusing on the condition and carers just focusing on the carers, because very often for us, when we have those conversations, if the cared for person's having a bad day, guaranteed the carer is. If the cared for person's in a good place, that carer is going to be in a better place. So whilst we are there to support the carer, we absolutely have that conversation about the cared for person, their conditions, their needs. Do we need to make referrals on your behalf to social work, for example? And that's the bit that is really, really crucial. So we're not just looking at the carer, we're holistically looking at everything. And going back again to what Becky said, let's change the narrative about these being two individual people. Yes, you're individual in your own right, but when it comes to having a caring role, you have to look at a more holistic approach. That's me.
Thank you very much, Caroline. Does anyone else want to come in on that before I move on to the next question? No, that's fine. Just wanted to give everyone the chance. So neurological conditions, obviously, very many of them. There's an estimated 600 different neurological conditions, and some of them are very complex. Why is early intervention with carers so important, do you think? Caroline, I'll start again with you on this one.
Thanks, thanks, Alice. Yes, so I would say the provision of the low-level community-based support is really, really important. If carers know what support they can access and where to access that information at the right time, then essentially you're avoiding a crisis. And I know obviously within health and social care it is about taking preventative measures. So I do believe that charities and carer centres are working towards that same goal. And let's face it, it's going to cost health and social care so much more money to actually intervene at the crisis point. It's going to, if we can get in early, it's going to really support the carer in terms of putting some strategies, some resources, some supports in place. And I want to at this point mention, just the real sheer power of peer support as well. Just for carers to realise that they're not alone. That was a really crucial thing for me on a personal note. And it's also something that we hear every day when we speak with carers. And, if carers do present to social work and they need like emergency respite care, if there's a breakdown in relationships, all of these kind of things, that is when it is going to cost far more. It's going to be detrimental to the carer's own well-being as well. So it's the early intervention, and early intervention, easy for me to say. For me is and that's what I said in my wee intro slide when you were promoting the event as well, is that if we can reach carers, perhaps, so for example, if it's maybe a parent at the point of that diagnosis as well, when the child is young, rather than waiting until 10 years down the line, something simple as a parent not even knowing that they can access a child disability payment. These are pieces of information that can make all of the difference to families and to unpaid carers, but they have to know that information. Do require on our services to do that, but it shouldn't just be a standalone approach with a carer centre or a condition specific organisation. So if we work together, we can absolutely achieve change in terms of early interventions. And I'll stop there and give Becky a chance.
Thanks, Caroline. I think that ties in nicely to what Steve's just put into chat, which was that it's important to describe what carers are entitled to as carers. And I think one of the hopes we have from this event is that we get some joint working between the neurological charities and the carer centres, because if there's an option for one of the carer centres to do some training to the charities about the carers' rights, carer support, what the entitlements are, then that sets that charity up even better than they are already. So hopefully there'll be some good joint working afterwards as a result. But Caroline, I see you put your hand back up. Do you want to come back in again?
Yep, it was just on the back of Steve's point, and I think you're absolutely right, Steve. And I think that what a carer's needs are absolutely independent to where that person is within their journey. No two conversations are the same, but in saying that, there are some key pieces of information and key resources and supports that every carer is entitled to. And I know that we'll probably talk a wee bit further down the line about it, for example, around underpinning the Carers Scotland Act. So that would be the kind of basic information. So there's almost, it's not a script, if you like, but there's basic things that we would want to ensure that charities and carers themselves know about initially at that first point of contact, and then you look at the more bespoke needs of the carer and the person with the conditions when you get, you know, more into the conversation. But absolutely, and that is something through carer aware training that can be provided to other charities. Thanks.
Fantastic. Yeah, that's fantastic. Thanks, Caroline. Phelim, I wanted to come over to you as well on this question. So why is early intervention with carers so important?
Yeah, thanks, Alice. My answer to that is pretty much very, very like my answer to the first question about how we get people to see themselves as a carer. So we find, and this is from real feedback, that if we can engage the carer from the start of the person entering our service, or ahead of them starting if possible, we are able to just minimize that overwhelming shock and disruption to their life and to their emotions. And the more they can talk, it's all about talking, getting things off their chest at that point, and getting very simplified guided pathways into where they can go and where they can see. They'll often find themselves in a place where there's been a sudden onset, or even with a progressive deterioration with an illness. They'll often find that they've nobody to talk to, and they'll often find that people will keep away from them, which sounds really awful, but friends and family can actually disappear. And sometimes that's with the best intentions. And I've seen this with my own experience, that people say, oh, it just, I wouldn't like to disturb them. Or you know, it mightn't be a good time. You know, a lot of the time there's never a good time. But do you know what? If you pick up the phone and call somebody or knock the door, it will be appreciated. But a lot of people find themselves in the place where they've not just lost the person that they knew, but they've lost their own identity, and they've lost their own circles and communities. So getting them in and getting them supported, and an arm around the shoulder kind of approach at the earliest possible it's just such a changer. Because if they go on too long without engaging in that, or without getting supported, they'll just plod along, and that's going to be detrimental to their mental health, possibly their physical health, and their ability as a carer as well.
Oh, sorry, my alarm literally came on as you finished there, so that was amazing timing.
Wow.
And I was also thinking about the provision of information, and whether you had a view on how not to overwhelm someone when they come at the beginning with the information that could send them into a tailspin, and how to protect someone's, you know, emotional state whilst giving them the right information. How do you go about that?
Yeah, well, it depends on the individual circumstance, but what we would try to do is we would try to see what they need today, then what they need this week, and then start getting a bit more strategic. But there's no point in giving them, as even handed to them or emailed them, a list of, or a collection of documents for them to read through, that these steps and steps. Just have a gentle conversation over a cup of tea where you can actually give an overview of this form. You say, I can give you a hand with that, filling it out or contacting this person or whatever. So it's just about what they need right now to suit them best and to suit their loved one the best. It's about just being adaptable for that person. You could get a person who's absolutely on it and will just go through everything with a fine-tooth comb. They'll be very computer savvy, and things like that. But quite often the case is you'll get somebody who maybe never looked after finances for the home, never looked after the boiler being serviced or whatever it is, and all of a sudden they have to learn how to do all these things. You know, we've seen people where people in their 70s have had to learn to drive just so they can support a loved one. So it's just about giving them what they need at the specific time, at this point in time.
Wonderful. Thank you very much. Joe has put a statement into the chat, but it actually ties very nicely with the next question. So I'm going to ask this to Kathy. what would you say are some of the other barriers and challenges that exist to supporting carers of those with a neurological condition?
Can you hear me?
Yep, can hear you loud and clear.
Oh, that's good. I've put down geography because I know with the likes of Parkinson's, people live in isolated areas. It's fine if you live in a city and you can get to meetings and things, but when you're isolated in an area, it's how to reach them and how to support them. And certainly the Scottish branch of Parkinson's UK, I think they picked it up from the side-by-side course, because they now offer on Zoom a family, friends and carers meeting. And I was on that at the very beginning when they were trialing it. And they were getting a speaker like an OT or somebody like that to come and speak and how to cope with stress, etc. So they're providing that on a Zoom link, whereas in Edinburgh we try to give it in a face-to-face one now that we're over COVID. The other thing I find, data protection, which is so necessary, but we're not reaching. We know the nurses and consultants see far more people with Parkinson's than we're ever in touch with. And unless they are really want to know about things and go onto a website and find the Parkinson's Society, they're lost. Some people will do that and link into a support group in their area or help or whatever, but it's reaching. We know there are far more people out there, and because they can't share anything with the society, we're lost. They are given information about it, that there is a society, but at the early stages, they're not ready, some people, to link into that. So I think those are some of the problems I would find.
Yeah, so geography and data protection are not our friends. Can I ask that same question to Carol-Anne?
Yep, so if I can just come in on Joe's comment within the chat about people being scared to identify themselves in case that's just expected of them. Absolutely, 100% understand that people can feel that. I mean, you know, certainly in our local authority, some of our statutory partners will address unpaid carers as natural supports. And therefore, you know, if you're going out and doing a social work assessment and you see a husband, a wife, mother, father alongside offering a caring responsibility, then there is an assumption made that they will just get on with it and that's put on them. And I suppose that part of how we break that down is with the legislation. So that's the part that once we have the conversations with unpaid carers, we explain the legislation about them having a right to be involved in assessment processes, being treated as an equal partner in care. And actually the unpaid carer isn't the equal partner in care, the expert in care. You know, and for me, certainly I feel it's just it makes complete sense that you would want to involve the carer in those conversations. But I do completely agree with Joe that can be a bit of a barrier. I also think the GDPR, but Kathy has covered that perfectly. I suppose just on a personal note, because conditions affect everybody so differently, the type of peer support for carers can cause a bit of a barrier. In my own personal experience, both myself and my husband didn't want to engage with the local peer support because there was many people with physical disabilities as well, and my husband just didn't accept actually there was anything wrong with them due to a lack of insight. And I found that quite overwhelming. So I think one of the challenges is having a variety of different peer support options for carers, so that when we're signposting them to supports that you know they're going to get a benefit from, rather than it causing more anxiety and stress, or, you know, is that what the future looks like, those kind of things. And of course that is a challenge and is a barrier. But I think, again, that comes down to the initial carer support staff, or indeed any staff, you know, within a charity that's working with the carer, to kind of tease out what would help them and point them in the right direction, because we don't know what we don't know. And that's where we need the guidance of our charity partners and our carer centres. That's me.
Yeah, absolutely. Sounds, yeah, the getting everyone together and letting people know their rights has got to be the first step in stopping people from being worried about identifying themselves as carers, but holding as I think it was Becky who said earlier, there's an implementation gap, so that needs to be addressed, and that's what the good work that Carers Trust is doing to challenge that. So we've got one more question before we move on to the open floor, and that's, I'm going to ask it to Becky. What do you think carer centres and charities can do to come together to better support unpaid carers?
That's a really good question. So I think carer centres and local charities do come together. So I think the first thing I would say is actually where's the good practice around this already? And I'd say there's a role for Carers Trust, but also the Neurological Alliance as our kind of in our national structure piece that we've got. Actually, how are we sharing good practice? How can we kind of be conduits in that? Whether that's through kind of gathering that evidence. I think when we think about working together, and it can. So there's absolutely that key bit that's around like signposting to each other services. It's about a sort of knowledge exchange, training exchange, because I imagine carer centres, in a sense, their specialism is carers. So, if people come in with particular, caring for someone with particular neurological conditions, maybe it's got quite complex care needs, actually, you won't necessarily know about every one of the 600 neurological conditions as well as however many cancers. And, so actually, what's the kind of specialist support that we can offer each other, and in that very practical way. But I think also, and it's back to this point of the kind of carer and person being cared for kind of being seen in the same conversation. Actually, how can we kind of support each other's calls, like calls to action? So actually, how can the neuro condition charities be saying, and actually it's really important that carers' rights are implemented? When you're having your meetings, when we are having meetings with the carers policy team in Scottish Government, and you're having meetings with the clinical priorities team or whatever, how can we be talking about each other's challenges and sharing those key messages, and actually where's that kind of one voice bit? How can we do that sort of that campaigning and action together? And that genuinely is sometimes as like basic as retweeting something that somebody has said, so I think there's kind of real value in bits like that. And I would really encourage everyone in this room to think really creatively about how you can link up, and thinking about things like potentially joint projects, joint funding bids. Again, you will all be feeling the squeeze. I every conversation, every meeting I go to, what I'm hearing about is budget cuts. So our superpower in the third sector is that we are amazing at coming together and getting stuff done, right? So actually thinking beyond our kind of maybe usual channels, I would say, and some of the neuro condition charities will have carer specific services, like Headway and others. But actually, there's a really interesting project, I think, between a local carer centre and a local condition-specific charity, where actually you're providing different things, but within the same project and potentially within the same kind of funding application and things. And again, I think Carers Trust and Neurological Alliance have a role in supporting and facilitating some of that collaboration. So that's some kind of initial thoughts, but you're the boots on the ground. You know how to join up services. You'll already be working with kind of lots of, again, we're so much better at that than statutory. We're so much better at having a holistic, person-centered kind of journey through services. So I think the expertise to do that is in this room. It's how do we create the space? How do we lift our heads up high enough to be able to have those conversations, to have those strategic conversations when we're pulled into the day-to-day of running services? Again, I think we've got a role in that. So yeah, I really hope that this is the start of a conversation and not a one-off event, because I think there's so much scope, and I really do believe in that kind of power of a unified voice.
Absolutely, thanks, Becky. Yeah, it's definitely this. We're hoping this too, that this is the start of something. And towards the end of this session, we're going to put up a second QR code survey, and that gives give some ideas and suggestions of how people might take actions forward. So we'll come on to that in a minute. But before, I just actually wanted to go to you, Phelim, and get your views on, you know, you have an incredible service you offer at Edinburgh Headway Group. How can we come together with carer centres as you as a neurological charity to better support unpaid carers? Or what advice would you have for other, what advice would you have for other organisations?
To talk more, to reach out to each other, to network. I agree completely with everything Becky had said, but it's through the power of partnership that I've found we've opened up the floor and opened up our resources and friends that we can tap into, that we can share experiences with, that we can share space with. A lot of the time it's actually space is quite a challenge to get a bigger group together. Maybe you've got a premises where you can facilitate better. And it's about thinking outside the box. Okay, maybe you're creating a service and it runs Monday to Friday, but maybe that space is free in the evening time, when actually the carer could actually have a person available to take over their duties and free them up. So I do think we need to open up and be a bit more flexible and not rigid ourselves into 9 to 5, because the carer's role is not 9 to 5. It's 24/7. And yeah, I think it's just about networking, and I think it's about attending events like this and actually seeing, you know, there are people out there really trying to get the conversations going, and, you know, come along to things as you can. It's really tight staffing wise for all charities at the moment, but really, if you can stretch yourself to take time out, attend these events, look at the names on the screens, you know, look at who they're representing, where they're located, you know, and I don't think anyone in the room would mind anyone else in the room dropping them an email to say, hi, noticed you were on the call, you know, just when the meeting ends, you know, when your event ends, you know, just think, actually, who could I talk to from that, you know, just, you know, that a simple conversation or a little back and forth email might actually really open up doors and opportunities to provide for carers.
And on that note, if people want to email for contact details, our email is info@scottishneurological.org.uk. So I'll put that into the chat. But yeah, if you want to be connected to someone, or if you want more information about anything, then please do email us. Right, so we've tackled some really big topics in the preset questions. We've gone a little bit over time, but hopefully valuably so. I'd like to do the final Mentimeter thing towards about 12:55. So we've got a few minutes now to open to the floor, and I'd just like to start with a question from Katie Baker in the chat. I think it's a really relevant question, and it is open to all panelists. In what ways, if any, may support to carers of people with neurological conditions be different from that offered to all carers? Would anyone like to come in on that? Carol-Anne.
Hi there. So I think the key thing for me is it's not about what the difference in services would look like, because I think that's an individual conversation. But I think one of the key things is understanding that for many, not all, but for many neurological conditions, it's a hidden disability. And there lies, you know, a huge challenge. It's a huge challenge even for you know, for carer centres and charities to help identify these individuals, because they don't, they make, you know, using my own story as an example, for anybody, you know, the naked eye, my husband looks absolutely fine. They've got no ideas of, you know, what those challenges look like on a daily basis. Whereas I have no doubt if he was in a wheelchair and you know, had a visible physical disability, then it may be easier for people to offer a wee bit of support. So I think in terms of that question, again, it's down to the individual conversations. It's having a wee understanding of what's going on for you, how the condition that your loved one has is how it's displaying itself in terms of behaviours and, you know, needs and triggers and things like that. But absolutely, you know, if you're an unpaid carer, you're an unpaid carer. You still have the same rights under the Carer Scotland Act. You know, you still have the right to access an adult carer support plan to break down what your needs are. So again, for me, the answer to that question is more just about having the one-to-one conversation. But hidden disabilities are incredibly challenging for us within the carers sector, and also for charities themselves. I hope that, I don't know if that answered the question, but that's where I was coming from.
Yeah, and if I can add to that as well, I think there's something about the complexity of neurological conditions as a whole, which can impact people in a myriad of different ways. And you could be facing someone who is, you know, has bladder and bowel problems, or someone who has balance, movement, coordination issues, or someone who has terrible fatigue and really has to plan their day incredibly well, and anything that comes in could throw them off what they were trying to do. There's as not only is it hidden, but there's incredible challenges with the way your body moves and works. A lot of neurological conditions impact muscles. There's muscle weakness. There's each one is different. And that's where we'd really encourage the carer centres to go to the charities under the Neurological Alliance of Scotland on our website, under our members page, and see more for more information. But on that note, we are also in the process of pulling together an A to Z of neurological conditions and the charities under the Alliance that support those conditions. And this is hopefully going to be a really useful resource for carer centres to see at a glance how how a condition will impact someone in 2 to 3 lines or 2 to 3 sentences, and then you can signpost people to the charity that can help. So I think there are a lot of different things that can be done to support people with neurological conditions. It just depends which condition that is, if that makes any sense. Would anyone else on the panel like to come in on that specific question before we move on? Nope. Okay, what we're going to do, I can't see any more questions in the chat. Would anyone like to put their hand up if you have a question, and hopefully I'll be able to see you.
Alice, I think we have, oh sorry, I think we've got Crippen and Mary who have had their hand up for a while.
Wonderful. Right, Crippen, would you like to go first?
Well, thank you. Basically, it's really struck me today about the panel, particularly saying about this reluctance to admit that people are carers. There's almost stigma attached to the word as well. And I don't know, do the panel not think there's a bit more fundamental work to be done around breaking down those barriers and making people understand that there's no stigma to being a carer, is my first point. And I do have a second point very quickly as well. And in terms of the second point is, I often say, who cares for the carers to my community? And, you know, I've heard so often where somebody might be caring for somebody with a long-term condition and say they passed away, and that carer is totally lost because they've lost all their focus in their life. So how do we encourage carers to keep that, if possible, and I know that's a big if possible, keep that variety in their life so that their focus is not just on their care work and the care duties they're doing, and is focused on other things so that they do have a more rounded life.
Thank you, Crippen. So just, yes, Hester raises a good point. Crippen, do you want to just say which charity you're from?
Yes, sorry, Crippen Droner from the British Polio Fellowship. And
Crippen, was that open to any of the panelists, or do you have one in mind?
No, I think it's whoever wants to answer it, really.
Okay, panel, over to you.
I'll come in on the first point around the stigma, if that's okay. So I absolutely 100% agree with you. So we talk about this all the time around the kind of stigma of caring and it being really complicated. And we are constantly kind of campaigning and talking about and trying to pull apart this this kind of this stigma. I think a few things play into that. So I think it's back to this approach that we look at carers, and we see this a lot with young carers actually. So young carers might not necessarily want to talk about their the details of their caring responsibilities because it's somehow like disloyal to family, or you know, you don't want to kind of share your business or whatever it is. And I think that's absolutely fair enough. I really do. But actually what we need to be thinking about, and this is probably actually a challenge to all of you as well, is actually how are we taking that whole family approach so that stigma actually just doesn't have a place to breed. But absolutely, and we need to really be promoting that kind of very publicly, and that is key to the work that we do, trying to pull some of that across. It's really complicated. The caring relationship is really complicated, and it's okay for us to say that. And I think the more of us that say that, the easier. That's how stigma changes, right? You kind of you wear it down bit by bit, and you share your own perspective or view, and it's really okay for it to be complicated. I think, Caroline, you talked about the big smile you have to paint on your face. The people that you meet, don't make them paint that smile. Just let them show up how they show up, and you will all be doing that anyway. But actually, that's how we create caring communities. We normalize that. We normalize that people can, you know, show up however they are. But the thing is, like, for me, like, carers can't wait. So we need to be doing these two things in parallel. We need to be supporting them to identify, because actually that's the key to getting, you know, what you need. But at the same time, we do need to be challenging and changing the narrative and the perspective of what it means to provide care, and those things kind of have to happen at the same time, because it takes a generation to kind of shift some stigma, really, and we don't have that. We need to be doing something about this right now. But I think it's a really good and really important point, so thank you.
Oh, I was muted there. Thank you, Becky. Would anyone like to come in on Crippen's second point? Crippen, would you like to repeat the second half of your question?
It's related around who cares for the carers and encouraging carers, particularly unpaid carers, which is what we're talking about today, about having a more balanced life and not focusing fully just on their carer role.
Kathy, is this something you might like to come in on with your side-by-side hat on?
Yes, I mean, this is why we provide the therapy at the end of the sessions. It's to let them, encourage them to have time for themselves. It's very important to have time for themselves, even if it's just to go out and meet somebody for a coffee. But they reach a stage they can't leave their partner, the person they're caring for. And that's where we need something like a befriending situation where people can go in and sit with them. And again, this is your GTB. There's so much in the way of barriers stopping people wanting to help because of all the loops they have to go through to become a befriender, and then the family getting it. So there's a lot of barriers there, but yes, it's important. We say again and again and again, you must take time for yourself. And if they're very early in a diagnosis, encourage them to get involved in something that their partner's not involved in, so that it reaches a stage they can still continue that even after the partner's gone, because they've not got a memory saying, oh, I did with my husband, I can't continue it. It's important to have something completely different.
Mm-hmm.
Yeah.
Mm-hmm. Thank you, Kathy. Oh, did you want to continue?
I was going to say, this is why we changed it from a carers course to side by side, because they don't like being called carers, but they live side by side with somebody with a condition.
Mm-hmm.
So,
yeah, that's a good example of that. And before we move on to Mary's question, Caroline, I see you've put your hand up. Did you want to address Crippen's question?
Yeah, it was just very quickly that I think it's a really good question, Crippen. I do think that, you know, the very nature of when you have a caring responsibility, you're very selfless, and, you know, you don't have much time in your hands, so we miss our own GP appointments, our own dental appointments, and actually part of the, I think again, regardless of what door the carer presents to, it's about having that conversation. And sometimes it can be, dare I use the word, quite brutal, but you have to be very honest in terms of, you know, if you continue at the level and speed that you're continuing without any supports, you're going to have the cared for person in one bed and you're going to have the cared for across the hall in another bed. You know, and that can be quite a tough, difficult conversation to have. But it is really important. It's really important to nourish and support carers to understand their value, but actually the implications if they're not able to continue with their caring role. Thank you.
Thank you, Caroline. And Steve puts a good point into chat that actually some carers have their own conditions or their own challenges. So that's a really important point as well. I'm going to move on now to Mary. If do you want to come in and say where you're from and what your question is, Mary?
Yes, I am chair of the Scottish Tremor Society. I have a question. I don't know if anybody can answer it. For myself and for a client, we've both been diagnosed with essential tremor, but with the added complication of brain damage. Now, what we've tried to do is access our parents' medical records of the birth, but we cannot do it because we've been told it's on microfiche. Can anybody suggest any way around it?
This might be something we have to look into after the meeting and come back to you on, Mary. I don't think anyone here would be able to help you on that one specifically now. Before we move on to actions, we're all going to, or sort of like a discussion about how we could all work together. So this isn't just a one-off standalone meeting. We don't want this to be the start and the end of the conversation. We want this to be an exploration into what we can do from now to bring the neurological third sector more closely aligned with carer centres and to give better support ultimately to carers of people with neurological conditions. To start, can we just, Hester, would you be able to put the QR code up for the second poll? This has got a few more questions, but one question in particular asks you to think about any actions you think you could commit to or you'd like to consider to take things forward to make sure that you're part of this ongoing conversation. We certainly would like you all to be part of an ongoing conversation. So again, there's the camera QR code, or we can put the link in the chat box.
Yeah, links in the chat should be.
Oh, fantastic. Thank you, Hester. Quicker than me. So we'll just have a few moments now to go through. There's a few more questions here. Okay, and what we'll do is, as people are finishing that, Hester will be able to get the results. So while we're waiting for everyone to finish, should we just have a little discussion about how we would all like to work together to tackle some of the issues raised today? Hester, would you unshare that
Yeah.
slide so we can see, I can see everyone. Thank you so much. Panelists, what would you like to do? How would you like us to all work together? There's obviously an appetite for, you know, you've enjoyed the collaboration on this event. What would you like to see next, and how can the Neurological Alliance of Scotland and Carers Trust as partners help deliver that?
I think for me, Alice, I'd like to, when we spoke at the start, the panelists said 3 things they'd like to happen as a result of this get together. I think it would be really interesting to ask people to ask themselves what 3 things they would like for themselves. And you know, is there anything you've tapped into throughout the session today that resonated with you and gave you a light bulb moment that thought, oh, actually, I could do that, or I could contact this person, you know, or see other similar charities or organizations within your locality. And also, yeah, definitely to keep attending these type of events, keep the conversation going.
So you're saying we want people to take actions, take 3 things they'd like to do to carry this forward?
Yeah, even just to say to yourself, as we did as panelists, what would you like? And maybe some of today's conversations will give you the answers to what you would like to happen. And then think about, well, what could I do about that? You know, and maybe we could come back as a group again with the feedback from that, you know, and share that, or share it on some kind of a platform where we can say, well, this person decided to do this, this, and this as a result of the meeting, and it was a great success. And just we can keep the kind of progress flowing and sharing our experiences.
Fantastic. Yes. So in the survey you've just done, you'll have seen some options for how, you know, whether you might be able to offer training to neurological charities on the Carers Act and carers' rights, and whether neurological charities can do the same and offer condition-specific training to the carer centres. We're interested to know whether there's an appetite for a working group from people in this room. We're interested to know whether people would like to be connected on a very basic level in a WhatsApp group, and then you could share questions within the WhatsApp group and have a friendly, safe space to get some answers and further collaboration. Becky's made some brilliant suggestions about doing joint funding funding bids, and being seen, you know, working together openly and supporting each other on that. There's also the role for the Alliance to support carers and back up the needs for more support for carers in our conversations with Scottish Government. Before we end, I just wanted to ask Hester really quickly, was there an outcome that had more interest than others from the survey that we've just done?
Yeah, absolutely. It's been really great. So we've got a lot of people saying that they'd like to attend more events like this within the next 6 to 12 months, which is great. A lot of people also who'd like to join a networking group between carer centres and charities, and like to network directly with people on the webinar. So that's really, really fantastic. There's also good appetite for offering training. So we've had amazing responses across the board for people wanting to take things forward. So I've taken a screenshot of it, and I've also popped in the chat that you can download these results yourself. You can get them emailed to you, so you can have access to that as well. But we'll share it after the meeting with everyone.
Thanks, Hester. That's brilliant. And thanks everyone for taking part in that survey. Just to follow up that we'll close the meeting now at 1 o'clock. Thank you very much to my wonderful panelists for being brilliant and sticking to your 2 minutes. Thank you to the audience for all of the questions that you've asked and for being part of this. Hester's sharing the contact information for our panelists today. If people would like to contact specific people in the room and you don't know how to get hold of them, you can email us on the info@ email address, and we will be following up with everyone with our carers support fact sheet, which is an A to Z of neurological conditions and the charities that we have in our network who work under those conditions and how they can support carers. And we also have a report that I alluded to in my introduction that we'll make sure everyone gets a copy of as well. Thank you so much for everyone for being here today. Hope you found it enjoyable. And yeah, that's the end of the meeting.
Thank you.